Hello, my name is Vanessa Garcia Gonzalez, and today I will be doing the IV start and discontinuation. I am in my Nightingale uniform, have my name badge present. So I will go ahead and begin. This is for Nightingale College. I will go ahead and begin by knocking at the patient door. Hello, Mrs. Smith, may I come in? Thank you for letting me in. So today I will be starting the IV that your doctor has requested, but before I do so, may I have you confirm your first and last name and your date of birth? Perfect, and it matches with your wristband. Okay, so I have gathered all my supplies and it's here in the room with me. I have provided privacy for the patient and made sure that the bed is at the appropriate working level for my height. I will go ahead and apply my hand sanitizer for hand hygiene. And due to the gloves that were provided to me were a little bit big, I have my own gloves. So I have them right here. Hand hygiene was performed. So I'm going to go ahead and start off by getting my IV extension and saline solution together. So I have my equipment here and I will be disposing of it right here. Disposing of it. I'm disposing of it all right there. I will apply the IV extension to the saline solution and I will make sure that there is no air bubbles. So I will push out and I will see 1 to 2 drops come out. Perfect. I will place this on the side, make sure it's nice and safe. I will now start off by going to apply the tourniquet. And just to let you know, I have clarified that my patient has no allergies or sensitivities to latex or tape material. So we're okay to use all the supplies I have. So I'm gonna go ahead and start off by applying the tourniquet. And I'm gonna go ahead and let you know that Mrs. Smith, it might be a little tight, but it should not be to the point where you're uncomfortable. I'm gonna go ahead and when I tie it up, I'm going to make sure that it's easily able to release and that the tourniquet is 4 to 6 inches above the IV site. I have measured with my fingers and it is perfect. I will begin by cleaning with my alcohol pad in a circular motion going outward. Perfect. I have my 22 gauge needle catheter. That is 1 inch. Dispose of that. I will ensure that my bevel is facing up and that with my opposite hand I will go ahead and anchor 1 inch below the IV insertion site. Okay, my bevel is facing up. I will go ahead and anchor it. Perfect. I have now received flashback, so that means I will insert 1/4 of an inch forward and then leveling. I will add the perfect. Now that my catheter is in, I will retract my needle by pressing the button, but due to limited supplies, I shall not retract it today, in case I need to reuse it. I will dispose of it in my sharps container, right in here, and I am applying pressure right here. Sorry, I am applying support right here. I will release my tourniquet from my patient's site. And now I will go ahead and add my IV extension and fluid. So now that it is added, I will ensure that I am getting flashback. So there's blood flow right here, perfect. And I will begin by slowly pushing in my solution, making sure that patient is tolerating it well. Due to time purposes, I will not insert the whole thing for this video. So now that that went in, I'm going to go ahead and clamp my, stop it, I am so sorry. So it is clamped. I'm applying anchorage right here. And this is in a safe place where it's not touching anything. I will go ahead and apply my Tegaderm. When I'm applying my Tegaderm, I am going to go ahead and ensure that I do not get the IV extension in case anything needs to get changed. Okay, catheter is on. I will apply my extra piece of tape to this part right here, like so. I will go ahead and really remove the white part. Perfect. And I have right here this little tape where I'm going to be adding my initials, which is VG, the date, the time, the measurement of my catheter, which was a 22 gauge 1-inch needle. So I have added that information. I will apply it to the site. Okay. I have picked up all my trash, disposed of it all correctly. I have put my patient's bed at a safe level for her. I have given her a call and seen, is there anything else I could do for you today? Alrighty, well, if there's nothing else, I'm gonna go ahead and step out and give you some privacy. Removing my gloves, performing hand hygiene, closing the door behind me. Okay, excuse me. Okay. Now I will go ahead and discontinue the IV. So I will begin by knocking at my patient door. Hello, Mrs. Smith. Thank you for letting me in. My name is Vanessa. I will go ahead and remove the IV that we have started for you today. May I have you please confirm your first and last name for me? Perfect. And your date of birth? Perfect. I have verified. Perfect. Alrighty. So I'm going to go ahead and remove the IV, but before I do so, privacy has been provided for the patient. But before I do so, any sensitivity to any tape or latex that I should be aware of today? Perfect, no sensitivity. So I have my supplies here already. I'm gonna put the bed to an appropriate level for me to work at. Hand hygiene, and again, my gloves. So I will go ahead and begin by putting on my gloves and making sure that I have my supplies I need already ready, which is my piece of tape and my gauze. Perfect. So I will go ahead and start by removing the tape. When I remove so, I want to do it at a parallel level to the skin so it's not uncomfortable to the patient, and disposing of it in the trash. Always anchoring the catheter. So that was So I'm gonna go ahead and again, parallel to the skin. Thank you for being so patient with me, Mrs. Smith. I know that this could be a little tedious. Okay. Anchoring right here. I have my gauze already ready, so I'm gonna go ahead and just get it a little square. I will go ahead and put it a little bit on top of the IV site, pull out my catheter and apply pressure for 30 seconds. I am looking at my catheter to make sure that it is intact. It is still 1 inch intact, nothing there, and I'm gonna go ahead and dispose of it in my sharps container. Perfect. 30 seconds have passed. My patient is no longer bleeding. I will dispose of this in a safe container. And I have my second piece of gauze, which I will fold and apply on top of the IV, the site that the IV was placed, and I will go ahead and apply a piece of tape on that. I have disposed of all my trash in the safe container. Let's see. Remove my gloves, perform hand hygiene. Mrs. Smith, I'm gonna head out. I have completed my task. Is there anything else I can get for you before I leave? No? I will go ahead and bring the bed to the safe level, give her call light, close the door behind me, and I have completed this task.